This is a soap concerning a 16-year-old white male who is accompanied by his mom to the primary care for right shoulder pain that occurred 2 weeks ago. He says he has a history of running in the track team, and he does a counterclockwise on the laps. He notices that he puts more um, emphasis on his right arm movement than his left. He noticed, though, that increasing pain on movement when he was running. Right now, he is trying to increase his mileage, so he's been running a little bit more. Onset was 2 weeks ago. It is lasts as far as it is intermittent, but it has been 2 weeks, and he still says that the pain is a 6 out of 10. He says that the aggravating factors are more movement. He also notices that nothing really alleviates the pain. He does say, though, that he does use ibuprofen, but the ibuprofen is not been really helping as much. Um, he notices, though, that the pain is more anterior on the right side of the shoulder than anywhere else. He does say, though, that he has been overdoing it, and because he has a track meet at the end of March. He did have an X-ray that was done about a couple days after he noticed the pain. The X-ray was negative. He says, though, that comparing the right side to the left side, the right arm is not able to extend as much, and 90 degrees before he has pain. He does say, though, that he's never had this before. There is no medical history as far as any kind of congenital or family history, such as Danlos or Marfan. He does not have any allergies, no past medical history. His medications are ibuprofen that he takes 200 milligrams as needed, which of course doesn't work, seem to help. Social, he does not smoke, he does not vape, he does not do alcohol, and no, he does not do any kind of drugs. As far as the review of systems, it was negative except for the musculoskeletal, which was, of course, a positive for right shoulder pain, decreased range of motion on the right side. There is a palpable click noticed on movement, and he says that there's no muscle spasms and no other skin problems such as bruising or swelling. When I did the physical exam, I noticed, though, that there was definitely a positive NEARS, positive Hawkins-Kennedy, positive empty can, associated, though, with pain, especially when we were doing the range of motion test, and that was doing the abduction, adduction, also the internal and external, and on that active and on passive. But he could not raise his arms, and anytime he raised his arms any more than 90 degrees on the right side, he was in pain. There is a study by Palermo in 2022 that says PGALS, which is predicated on the idea of losing gait, arms, leg, and spine as a screening to find out if there's any kind of problems. Since this is an acute injury with repetitive injury as far as running goes, this might help with his future endeavors. A lot of times these problems occur because of the actual form of the patient. Since we're talking about a 16-year-old, it's acute. We do have a palpable click. We do have some physical signs other than, as far as we do have to make sure, though, that there is no growth, any growth plate, any kind of problems. We're going to, as far as our plan is concerned, we are going to look at the differentials of little leaks in shoulder, tendinopathy, and rotator cuff. Because, though, that there is no fever, there's no swelling, there's no redness, there's no any kind of problems as far as infection, tendinopathy is not one of our differentials. The other differential, the little leaks syndrome, does have a anterior pain with, of course, repetitive movement, so that is part of our differential, and the rotator cuff sprain is also in our differential. Of course, we do have issues with, of course, the supraspinatus, the infraspinatus, the teres major, and the subscapulars. As far as impingement is concerned, that is less likely. And as far as any kind of tears, since it is acute, that is less likely. So we're going to do with repetitive motions. The plan is, of course, to get an MRI with an ortho consult, rest, which is resting, elevating, compression, and, of course, ice. We can use biofreeze, ibuprofen for pain. We're going to use anticipatory guidance as far as watching, as far as athletes go, making balance between activities and sleep. We also want to make sure that there's some safety issues. As soon as we have the MRI and the ortho consult, we suggest to the mom and to the patient that we do not engage in any activity at this time until cleared by ortho. In the meantime, maybe we can do some range of motion rehab as indicated by ortho. Otherwise, though, we're going to wait until the MRI comes back to see if there's any kind of surgery that is necessary, or, like I said, just a conservative method as far as rehab, NSAIDs, and just rest. Thank you very much. This was my soap on musculoskeletal of an adolescent. Thank you. Let's see if it